Hi, this is Cindy, and I'm covering Lyme disease in Pinellas County, Florida. So, for more than 10 years, Lyme disease has been a hot topic. On one side are academics, pharmaceutical companies, and government agencies that claim that the disease is very mild and it's easily cured. And on the other side of the coin are chronic Lyme disease patients and their doctors who say that the infection can survive the standard 4 weeks of antibiotic treatment, and the impact of the survival is debilitating and it's difficult to treat, and 2/3 of patients that are treated fail. There's a conflict of interest for many of the individuals trying to set Lyme disease policy. These policies are created to allow data to get product approval, to have infected people get medication that they need beyond the standardized treatment plans, and set an official standard for diagnosis for the disease. It's being untreated by physicians, it's untreated and uncovered by insurance companies, and because of this, patients are becoming increasingly ill. Right now, there's 14 states that have protective Lyme laws that protect doctors who treat with longer courses of antibiotics and guarantee insurance coverage. These laws also protect doctors and other health professionals from professional conduct charges if they prescribe a course of long-term antibiotics to treat Lyme disease. But currently, Florida doesn't have any protective laws. It's important policy because in 2013, the CDC has finally revised its estimate of the annual number of Lyme disease cases from 30,000 a year to 300,000 a year. So to put this in perspective, the annual occurrence of Lyme disease is now 1.5 times more than the estimated number of breast cancer, and 6 times higher than the annual occurrence of HIV and AIDS. But federal funding of Lyme disease has been insufficient due to underreporting, misdiagnosis, improper testing to diagnose. So the numbers appear very low, and then this leads to less recognition and less funding for research. So Lyme occurs 6 times more often than HIV and AIDS, but it receives less than 1% of the funding that's given to HIV and AIDS by the National Institutes of Health. The insurance companies have put their full weight behind these outdated CDC guidelines from 2006, which is a very limited treatment. And current research is showing that this limited treatment is ineffective and is leading to chronic Lyme disease, which is then therefore very difficult to eradicate. So in awareness, and so because they're not being covered by this insurance, with these outdated treatments, patients are now paying out of pocket for treatments. And there's also a misinterpretation of tracking and reporting, and a lot of states don't believe that they actually have Lyme disease, but there's a lot of grassroots organizations out there that are doing their own tracking and show a much higher incidence and all over the country for ticks that carry the disease and for the diagnosis of Lyme disease. Florida has a particularly high rate due to ecological factors that produce a higher amount of ticks. It stays warm year-round. It leads to tick activity throughout the entire year. Deer, raccoons, mice, rats, all small mammals can carry ticks that transmit Lyme disease, and of course these animals can travel, so they certainly can go to other states. The Florida Lyme Disease Association reports the long-term cost of Lyme disease to Florida families, school systems, the healthcare system, and the economy to be an average of $61,688 a year. This was a few years ago per patient, and then if other complications occur, like the arthritis, add another $35,000, and for cardiac involvement, add another $7,000. So some of the big key players for Lyme disease is obviously the CDC, Big Farm, Infectious Disease Society of America, the ISDA has set up some protocols for treatment. Insurance companies, National Institute of Medicine, they've actually press charges against physicians for abusing antibiotics and doing long-term therapy. There's other interested parties are Lyme's advocacy groups, patients, doctors, people trying to make vaccinations, the vector control, trying to eliminate the Lyme disease at the source, medical device companies to get improved testing, because currently the testing is very inaccurate. So previous initiatives have been successful. Like I said, 14 states have protective laws for doctors and healthcare providers and requiring healthcare insurance. So Connecticut in 2009 they set up a plan for antibiotic treatment, not less than 30 days of IV antibiotic therapy and no less than 60 days of oral antibiotic therapy, or a combination of both. And it would be provided by board certified specialists. And it also protects physicians from disciplinary action for prescribing, administering, or dispensing long-term antibiotic therapy to patients clinically diagnosed with Lyme disease. And there's been a really important working group that's been established in Congress by Bill Schuster. And it just happened in 2016. It's part of the 21st Century Cures Act, and it provides a group that is experts on Lyme disease. They're reviewing federal efforts, they're coordinating, helping set research priorities, and they're compiling all this information. They're going to develop this report and give it to the Secretary of Human Health, the Secretary of Health and Human Services, and Congress on their findings, and then recommendations for the feds to for this tick-borne disease prevention, treatment, research, and so they're going to submit their very first report in December 2018, and they just had this amazing conference in DC just this month on the 11th and 12th, and I'm going to attach a video of a very young girl that was diagnosed with Lyme's disease. Well, not initially, and all of the torture she went through, and the scary thing is that a lot of children are coming in contact with these ticks, and they're the ones that are getting sick. So she did a really effective job in lobbying at this this working group meeting. So in Florida, there was a bill that died. It was a Lyme Disease Insurance Coverage Act, and it was in 2006. And as far as the research that I did looking into all the legislation in Florida, that was the last bill that was introduced in 2006, and it died in Committee on Banking and Insurance. So there's a lot that can be done in Florida, and really it's just finding the people that you need to talk to. And in Pinellas County, the senators are Jack Brandis, Jack Letvala, and Daryl Rusin, two Republicans and a Democrat, and become very well versed on your position, what you want to, like very simply, what you're trying to achieve, protection for doctors, for the long-term antibiotic therapy, and for insurance coverage, and get as many people behind you. And there's a lot of incredible Lyme organizations that are willing to go out and put the pressure out there, and and then hopefully get some funds redirected into the Lyme's research and make themselves known. Florida just had approximately 8,000 new cases reported in 2016, so it's on the rise, and I hope that you gain some useful information from my report. Thank you.